Hi there. My name is Shannon Restifo, and I'm currently a student in HLIN 321, Health Information Science and Healthcare Systems 1, taught by Professor Terry Rouse. The following PowerPoint presentation will be on the Canadian healthcare system and comparison of the United States healthcare system. In 1776, our founding fathers established a country of laws and amendments that would help this country grow. They never did think about how creating a healthcare system would benefit the future. Yet, if they knew the headaches the citizens of this nation are enduring to get decent healthcare now, maybe some policies back then would have helped in creating a universal healthcare system like Canada did. Our neighbors up north were able to view our country and the fragmented system, we like to say, that is adequate for most citizens of our country. It seems that the citizens of Canada hold Tommy Douglas as one of the greatest Canadians ever, due to his insight of what he wanted for his country. This is according to an article in the Washington Post that relays the story of how Tommy almost lost a leg due to a bone infection because his parents were not able to afford his medical treatment as a child. Well, Tommy healed and later in life became the Premier of Saskatchewan in 1944. It was during his term in office that he implemented a single-payer universal healthcare system that became the model for the rest of his country. Nowadays, this healthcare system is known as Medicare. In 1986, the Government of Canada created a national health plan called Health for All, a framework for health promotion. In this plan, it's outlined the national goals, identified inequities, clarified how to cope with healthcare problems, and how to generate supportive environments. They were the first nation in the Americas region to prepare such a plan. It is within this healthcare system, the federal government, that provides funding support for healthcare insurance to the 13 provincial and territorial governments, as long as the province follows regulations that are outlined in the Canadian Health Act of 1984. This act ensures that provincial and territorial health care plans are administered and operated on a nonprofit basis by a public authority and meet criteria for comprehensiveness, universality, portability, and accessibility. Federal funding transfers to provinces, territories may be withheld if they do not adhere to these Canadian Health Act requirements. Well, under this system, all Canadian residents have reasonable access to medically necessary hospital and physician services without paying out of pocket, which I think is great, as this is the primary objective of the Canadian healthcare policy that states, "It is hereby declared that the primary objective of Canadian health care policy is to protect, promote, and restore the physical and mental well-being of residents of Canada, and to facilitate reasonable access to health services without financial or other barriers." And it's interesting to know that private insurance is available to the citizens of Canada, and this helps them supplement coverage for non-insured services, which I will go over later in this PowerPoint. As this is an overview of both countries, the United States healthcare system falls a bit short from what Canada has done for its citizens. Our country has a fragmented nature, due in part to citizens obtaining healthcare plans through various means that are available to them economically. Though many may call this convoluted view a system, as it has various features, components and services, it is in no way a true system that works smoothly. There are two government-based insurance that help the elderly, certain disabled individuals, and indigents. These programs are known as Medicare and Medicaid. The program that helps children from low-income families is called Children's Health Insurance Program, also known as CHIP. It was noted that in 2010, the Patient Protection and Affordable Care Act was passed, and its main objective was to reduce the number of uninsured citizens. Those that are able to financially obtain private health insurance did so from participating insurance companies through web-based government-run exchanges. The Canada Health Act gives access to universal health care regardless of status, income, employment, health, or age. This means every citizen of Canada is able to get some level of health care, even if they are a student, unemployed, disabled, or on a pension. There are some things that are not covered, and they are prescription drugs, dental care, eye care, and glasses. With cooperation from the pharmacy companies, the drugs are set to a lower cost thanks to involvement of the federal government. And even though the prescription drugs and dental care, and eye care, and glasses aren't covered, they are able to be purchased through insurance from private companies and such. So, the Canada Health Transfer from the federal government provides healthcare funding to the provinces and territories. If standards are met with the healthcare insurance plans, then full payment is sent out. And these standards include public administration, comprehensiveness, universality, portability, accessibility. And that means public administration is to be administered and operated on a non-profit basis by a public authority. Now, comprehensiveness is where the plans must ensure all medically necessary services are provided by hospitals, physicians, dentists, but only when the service must be performed in a hospital. Then would the plan be covered. Universality, I can't say that. The province and territorial plans must cover all the residents in there. Portability is where all residents, when they travel within Canada, are covered, and limited coverage is also available for travel outside of the country. Now, this is interesting. When a resident moves to another province, they can continue to use their health care insurance card for at least 3 months, and then they can register into a new plan and receive a new card for there. Now, accessibility is where all residents, again, have reasonable access to medically necessary services. And this access is based on medical need and not the ability to pay. So that's a good thing. But also, the publicly funded system north of the border based this patient's access to rational by need, whereas Americans, we like to ration by price. So I guess they call that the American way. The United States healthcare system is where different people / citizens obtain healthcare through different means. There is a kaleidoscope of finance, insurance, delivery, and payment mechanisms that remain loosely coordinated. And we have learned a lot about that this quarter in our class. So I don't really need to cover much on that, I'm sure. And another thing we learned is that the market-oriented economy of the United States attracts a variety of private entrepreneurs that pursue profits by facilitating the key functions of healthcare delivery. Now, we see that all the time. And last but not least, government finances public insurance through Medicare, Medicaid, and the Children's Health Insurance Program for a significant portion of the country's low-income, elderly, disabled, and pediatric population. Key similarities in the U.S. and Canadian healthcare systems show that yet our healthcare systems may be different. There are some similarities. And one of them is consumer protection. And this is a major factor for both countries. And the other one, an example, is that they both protect competition in the healthcare industry. And they recognize that competition is a key component to driving innovation and ensuring quality care to our public. Another thing, federal agencies provide funding for healthcare, and they are dedicated to balancing this along with the consumer protection. So we're also finding that we are facing shortages of primary care providers or general practitioners in both countries, as there seems to be a need for this in any of the countries, since most doctors seem to want to specialize in a chosen field of their choice. So the differences between Canadian healthcare and United States healthcare. On the Canadian side, the healthcare services are paid through claims by billing government health insurance. 2, buying private insurance for healthcare procedures covered under Medicare is banned. 3, Indigenous people have higher suicide rates, infant mortality, and chronic diseases, as they are not really thought about under this healthcare system, it seems. For the United States healthcare, the providers compete for patients through areas of medical specialty, quality, or cost. And also, it seems like the citizens spend more per capita on healthcare than the Canadian citizens. 3, Native Americans are eligible for healthcare from tribal clinics, urban clinics, or hospitals per Medicaid or CHIP programs, or at least that's where they get their funding from what I've seen. The payment system for the Canadian healthcare system and United States healthcare system. Canada has a single payer system, which the bulk of financing for this program that's called Medicare comes from general provincial tax revenues, and the federal government provides a fixed amount that is independent of actual expenditures. So pretty much they pay the bills. The claims are sent to the government and the government pays out. Whereas the United States healthcare system, it's paid for by government programs, private health insurance plans, and usually through employers, and the person's own funds out of pocket. But we're finding within the United States that the high cost of healthcare can have several negative effects, such as when the government spends more on healthcare, the national debt increases and our funds available for other programs decrease, which I guess you could cover that as a similarity with Canada. And when people spend more on healthcare, they have less money to spend on other things. And when health insurance is paid by their employer, they are paid less. When employers spend more on healthcare, the cost of their products and services increase, and jobs may be moved to countries with lower healthcare costs. Another thing is that most people can't afford healthcare insurance, and those without that insurance, they usually end up having poor health. And they won't seek care unless it's a serious problem that could have been prevented if they had insurance. And last but not least, it's sad to say that medical bills that are not covered by health insurance can lead to bankruptcy. So we're seeing a lot of that in our country. And I'm sure it's seen in Canada, but not as prevalent as here in our own country. So here are my pros and cons for universal health care. The pros are hospitals and doctors provide the same standard of care at a lower cost. 2, lowers healthcare costs for an economy. 3, it eliminates administrative costs by eliminating need to deal with private insurance. Now the con side is without financial incentive, people may not be as careful with their health. 2, forces healthy people to pay for others' medical care. 3, most universal health systems report long wait times for elective procedures. So, does it meet the needs of its citizens? Well, for Canada, yes, for basic needs, but you have a wait time. Whereas in America, you're able to go into the emergency room if, you know, to get serviced or seen, as we see with many indigent folks do. But on the other hand, I'm so used to Indian healthcare that it's hard to see the other side of the coin, because I know if I call in, I can get an appointment, be seen, and I'm not billed. So it's just a hard thing to comprehend. But I'm sure the Canadians are happy with it as it is. And Americans, no matter what, they'll still do what they do.